Hi everyone, Dinesh Surasena here, and today we're going to be talking about injections to the anterior talofibular ligament, otherwise known as the ATFL. As with my previous video about imaging the ATFL, I would typically have the patient lying in a supine position with the knee bent and the foot placed flat on the examination couch. You will find that this is much more stable and comfortable for the patient and hopefully make the injections easier to undertake. In this situation, you can also place the foot in a slight inverted position to bring the ATFL or the area into a more superficial position so that it makes it easier to undertake the injection. And this is how I would typically undertake the injection. So using a hockey stick transducer, which has a smaller footprint, I would place it in a long axis orientation over the ATFL and have it running between the fibula and the talus. I would then introduce the needle from a distal orientation, guiding it down to just above the ATFL if you're doing a steroid injection, or into it if you're doing something like a Prolotherapy or PRP injection. And this is what you're hoping to see on the ultrasound. So on the one side you have the fibula, on the other side you have the talus, and running in between will be the ATFL, or in the situation where you're doing an injection, it may be partially torn or thickened, but you should still be able to see some of the ligament. If you're undertaking the steroid injection, you want to bring the needle to rest just above it. And if you're undertaking a prolotherapy or PRP injection, you want to bring the needle into the ATFL and distribute the substrate using a fenestration technique. In both situations, you may want to place a little bit of local anesthetic in the superficial subcutaneous layers just to reduce the pain for the patient. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter, Instagram and TikTok. And remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.